Health and Human Services Board, welcome everybody. First of all, one note, I got a call from Joe Demling this morning. Brother John passed away. They were our neighbors there in Farmington. There was 4 of these Demling kids. They were all big kids. Their dad Kelly and mom Kelly and Charlotte Demling. Let's see, his sister Kathy passed away about 2 months ago, and his brother Jim last year. So Joe's pretty nervous. He's the only one left, so we wish him the best. It's up in Tammy Peterson. She's sending out a card to him. If you agree, Joe, you know what the situation is. Are you ready, boss lady? Is there a green up there? Okay.
We're going.
Good. And first item will be approval of the agenda.
Will we approve the agenda?
Second. Motion and made and seconded. Any discussion? All in favor?
Aye.
Carried unanimous. Approval of the minutes of the June 15th, 2021 meeting. Any questions or what's your pleasure?
Move to accept?
Motion and seconded. Any discussion? All in favor?
Aye.
Carried unanimous. Disclosure of conflicts, I don't think any. Public comment, boss lady, have you got anything?
I would like to take this time to introduce our new public health supervisor. Garrett Eide is joining us. He's over on the wall. He came to us June 21st, and we've been baptizing him everything public health.
You want to tell us a little about your history, where you're from or live or?
I grew up in Blair Taylor, so about 2 hours south of here. Went to school in Menominee at UW Stout and got
How many Indians back then?
really.
Carry on.
Also, I got a wellness degree from Stout. Followed my wife around a little bit. She actually works for Burnett County in the zoning. She's a zoning specialist.
Interesting.
And we were actually living in Hayward. We're living in Hayward right now. And we're slowly working our way over. Actually looking for housing, so if you know anyone selling a hobby farm, that'd be great. And so I was looking over in the area and saw this opportunity come up, and after it, and I'm extremely excited to be really back in my degree, and I really enjoy public health. And the more I've been here, the awesome people here, it's been a lot of fun. Enjoying it.
Oh, that's awesome.
Can I ask you a question? What's the difference between the supervisor? Like, what if there are 2 different roles?
Well, he's manager over programs and staff, and Jean ultimately, she's health officer, and she has some direct supervisory responsibilities, but ultimately she's the one responsible for grant reporting, budgeting, program, evaluating needs, strategic plan.
How's our staffing in your department? We have any other openings, or we getting to be full staff?
We have a couple of openings, but we're doing pretty good. I do also want to take the opportunity to tell you that it will be Hannah's last meeting taking our minutes because we have stolen her. She's got a human service degree by trade, so we're going to bring her in as a social worker down in Department of Children and Families on the 26th. So we're excited about that. But
I think you're very lucky, very fortunate.
yes,
Congratulations.
we're excited about that. So yeah, just our normal filling of positions with people.
Anybody else got anything under public comments? Okay. Number 6, I don't think is anything. We'll move on to number 7, Gene Schultz. Glad to see you today, Gene, and the floor is yours.
Right, some brief COVID updates. So for positive case counts, the month of June ended with 29 positive cases. For the month of July, we're at 3. So that's great news. Our percent positivity has decreased from 3.6% last month to 0.43%. The state is at 1.3% positivity. Our vaccine percentage has increased to 40%. I can't read. The state is at 48% of adults having completed the entire vaccine series. Our adult over 8 completed series, over 18, so that's just a specific age group in our county, is actually at 52%. As you know, we only have Pfizer that goes from 12 and up, and we at the county don't have Pfizer at the moment. With our total mobile clinics update, we have completed 35 site visits, including 3 migrant worker on-site vaccinations at farm. So our total doses we have given out since May is 690 doses with our mobile clinic. We're averaging about 20 doses per clinic. So we still offer our walk-in vaccines here at the government center. We have given out 72 doses, with some of them being our second doses from our mobile clinics. And then our testing has decreased, our saliva testing, but we still offer free saliva testing here. We have given out 190 tests total with 27 positive cases. So overall, COVID has decreased. Our vaccine demand at our mobile clinics is still steady. We have some days where they're a little bit slower than others. We are looking to sunset that at the end of August with our health equity grants. And then if we need to work with schools, we can do some on-site vaccine visits then.
We got a fairly busy walk-in this morning, haven't you?
I don't know if they're all here for COVID shots, but if they are, that's fantastic.
I met some people outside, that said they'd been in for testing and, for their vaccine shots.
Yeah, that's great. Yeah, we've had in the last week I think we almost had 20 people walk in for a vaccine. So that was, I think, one of our highest days. So I think that's really, really good. So there's still the need to have vaccine. I'm not sure if we need to strategically mobilize at certain locations that we have to, where we've had a higher volume. That's where we're kind of looking to modify our August calendar, is to really hit those areas where there's been a higher people coming through to us.
I think it's kind of all of us up to a committee to encourage people, and thanks for your volunteer helping us.
Find any evening, are you doing any evening?
Yep, so our mobile clinic today is in Clear Lake, I believe, and they go from 1 until 6. We're hoping to do in August, do some weekends, that maybe not so much in the morning, but maybe in the afternoon. And we're collecting data as well to really figure out in the future if we're going to do this again for another vaccine, for a booster, or even just getting public health information out. Where do we get the best response from the public? So we're collecting that data to use in the future, but we're hoping to do a couple more evenings, and then also connect with some partners for Pfizer and connect with like school athletes to get some more traffic to getting students vaccinated.
And you want to show them your nice volunteer shirt? Boy, that's pretty awesome. Is that one of your?
You can turn it on.
I know it. I wondered if you've gotten any, have you decided to be present at the fair?
We will be present at the fair, but the fair board has indicated that they would prefer us not to give vaccine. So we're going to be there to promote vaccination and partner with ADRC at their, I believe it's a building. I have haven't been to the fair yet. I'm very excited. And we're hoping to have some incentives to get people vaccinated, but we're just going to be promoting vaccination.
Did they give you any reason why? Well, I think that's a tragedy. I think
The reason why is that they just decided as a board that it wouldn't be in their best interest to have vaccines there. And I kind of agree. It would have been a great location because we could even have other visitors to the county could have gotten access to vaccines. So that's.
Well, I think that's kind of tragic. I think that was a great opportunity. It's a county get together, and I would think that should be one of our main interests, is to reach out to the people there.
Yeah,
It was an insurance issue.
I have no idea. That's all they said. Tanya did reach out for feedback. I don't think we heard any more. And I was just also hoping, because we have been finding that one of our feedback from people who have come to our mobile clinics is that if we weren't there at that right time, they wouldn't have gone out of their way to get a vaccine. So that's the big feedback. And so I'm like, we're trying to figure out where people are going, and fair is big. I love county fairs. I'm like, this would be a great time for us to try to encourage people to get vaccinated, or at least we'll be there providing the education, but it's not the same as being like, okay, I'll get a shot today and we can just vaccinate on site.
You've done like the St. Croix Falls, just on the overlook, they get a ton of people.
Not yet, but I know I have my staff working on what we're going to be hitting up next, because they're trying to target those evening clinics.
Wanigan Day is coming up.
Yeah.
This
I
month.
know we reached out to them, and I think there was something, a conflict with either paperwork, or we just had issues with that.
Some sort of weird insurance thing going on here. Whatever.
There's also the Wings and Water and Wings or
Oh, the
whatever
Wheels
it
and
is.
Wings.
Wheels and Wings in
Osceola. That would be really good. You have till September to get that.
There'll be 10,000, there'll be 10,000 people there.
Okay,
Yeah.
I'll look into that.
If they just voluntarily presented themselves and maybe signed, yes, I'm volunteering myself for this vaccine, you would think that would take the liability.
Yeah, and I mean, have those consent forms. We don't force anybody to get vaccinated. We've had incidents where they sign the form, let them ask as many questions, and they decide not to. And we're like, that's fine. Here's some information if you decide in the future. So again, it's all completely voluntary, no enforcement.
The reason why I commented on that is the Fair Board is having a big controversy. And they backed off of several things that the county has sponsored. I think that's the reason why they're doing this. Letter sent to them about opportunity that they turned down. I think it's fair. I'll see if I can get something written up and sign it. I'll put
Letter to the
together
Fair
a
Board.
comment on this Fair Board making that decision.
Yeah. Yeah, I think, Gene, any of the community events that are coming up, whether it's Wanigan Days or the Wheels and Wings or any of those huge things. I don't know, Amory has something, their fall festival that they have. But I think if you do it and you have the help to do that, that would be a great opportunity just to say, yeah, it's a voluntary thing. Either do it or you don't.
And do you need are the volunteer
Yeah,
corps
we can-
needed?
Right now, we had a couple nurses retire. So Jill and Debbie are no longer here. They retired after 30 years of nursing, so that's great.
John Lesky Johnson?
Mhm.
Yep.
So they did retire, and we have reached out and have a contract nurse at the moment, because we are currently hiring for a nurse. Interviews are on Wednesday and Monday. So we do have the staffing right now to still use the mobile command center to get it out and about and driving around. So staffing, at least for now, is not the concern. And then this fall, when I'm hoping to have another nurse on board, we're also hiring internally for a health educator. So we should have the staffing to do it. It's just making sure that we have vaccine and access to the mobile command center, because that has worked out really well for us.
There you go, Rita. You probably got 2 hours in your schedule a week.
I can volunteer, I bet, I can
Grab her.
volunteer.
Yeah, but that's the other thing. I'm also going to be working on an update for our volunteers here probably within the next 2 weeks, once we have more firm dates. Because even though we have public health staff there, I would still encourage any volunteers who want to volunteer. Because again, you guys are our public health champions. You can spread the word just as easily. You may know someone, get them in, spread the word. Word of mouth is great. So that's going to be coming out because we're modifying our calendar.
And the other thing, I don't know if you thought of this, the lake home owners associations always have their annual picnics and their annual meetings. If you get a list of those people, that might be an opportunity too, because there are a lot of people that own homes, obviously, that come from Minnesota, but still the local folks that are here, that might be an opportunity too.
Also,
If we could have some kind of banner maybe with your phone number or something that for each, move to each one of these events, we'd pick up a lot of people.
we'll definitely look into that. And then when we do mobile clinics, we have bought some really big signs. They're huge and they're very eye-catching. And we do have staff go out and put some yard signs out to direct people for free COVID shots. So we do have that every time we do go out. So, but for sure, we need more advertising in the community on where you can get a vaccine.
You want to go into number 8 then on the lake algae?
For Loveless Lake, I have some great news on Loveless Lake. The last water sample we collected was on June 7th. So that water sample came back at 1.6 micrograms per liter, which is way below the 8 micrograms per liter as the water standard set by the EPA. We have also started our microcystin water test strips. So those are like real-time levels that we're checking. Since we've done it weekly since June 15th, all of those have been less than 1 microgram per liter. So that's great. Water clarity has improved. I still have a water advisory at the lake just because we don't know what's really happening with this type of algae. It could bloom again. So we have the same best public health practices to just avoid areas where you're cloudy, lots of algae floating, don't swim there. And the other big update is we have posted permanent aluminum signs around the boat landing with pictures of the algae, best health practices, and then also phone number and email address to contact us if there's any concerns.
You know why it went down?
We don't really know. It could be the weather. We didn't do anything. This all happened by itself. Before June 7th, the water turned like a bright turquoise apparently. And then we took a sample, I believe on May 24th, and that was 21 micrograms per liter. And then it did this weird color change system, and then it went to 1.6. And we just don't know much about the life cycle with this algae, if it's going to come back again. It could be the weather, different water, like less water. Like without doing a full investigation, we really don't know why, which is why there's still water quality advisory, because I don't know, it could come back tomorrow for all we know.
The alum they put in last year.
I don't know.
They treated.
Did they do treatment last year
Huge treatment.
at Lovelace?
Yeah.
No,
No alum.
no alum.
Oh, was that the other one?
Long Lake.
Long Lake.
Did that? Okay,
Long.
never mind.
So we haven't done anything. It just naturally did all this.
I did mention to a couple of the bass clubs, because they had tournaments on Loveless, and I mentioned to them about that high algae content, so they canceled and changed lakes. And the concern that I had there was boat trailers going in, having it attach, and then bring it to another lake. So I know that there were no tournaments on there.
Good job, Bill.
Yeah.
Good job.
Thank you.
Something a little different, you know, you think of.
Did you have any comments on yeah,
We have been working with that group to help areas of concern, surface water runoff. So we put together a design and cost estimate for water and sediment control basin to help hold back some of the surface water runoff from the agricultural watershed that's west side, and help with any nutrient loading. And there was a practice put in there in the mid-90s that feel is maybe undersized, and this practice will help that well, or that particular inlet. We've been working with them quite a bit, actually.
I think that's all good news, and it's apparently showed some results that are just between here and Centuria. I think I saw about 4 or 5 ponds that are completely dry, and
Yeah, it's really dry.
the cracks are so big that, boy, it's gonna take a lot of water to fill them cracks. Well, thanks, Gene.
Thank you.
Tanya, I guess you're next on the Wapagas. Do you know if Bob Kazmierski he's not on our agenda?
I am using my hours to reassign that to Eric White.
Do you know,
He's going to give the update on Lake Waco.
do you know if Bob could stop in before our meeting's adjourned. I got
John,
some
he's down
questions.
at the,
Yeah,
he's
he's,
at P-TAG.
he's on another assignment
Oh,
for
okay.
trail, public input sessions. So he is not gonna be in until probably early afternoon.
He might still be out all afternoon. We go back at it this afternoon.
Is that right?
Yeah.
Okay, all right. I knew they were gonna be.
My question on that is, the Health and Human Services, I'm the county rep for the Wisconsin Counties Association. And Friday is our steering committee meeting at Stevens Point. And our Polk County has one resolution in there. I'll read it to you afterwards. And it's already been passed by has to do with staffing funding, been passed by the resolutions committee. So I'll be speaking to that on Friday. And I gotta get up to speed if there will definitely be some questions from some of the counties. I'll be positive on that. I'll,
You want me to have him contact you?
yeah, would you have Bob contact me? We can maybe do something on phone. Maybe Thursday, I'll be up in Balsam Lake Thursday morning. Maybe I can get an appointment. We should probably sit and visit for a half hour. Yeah, no. Okay, Tanya, sorry for that interrupt.
Okay, so Eric, you want to give the Waffle, Lake Waffle update?
Thank you very much. I have quite a bit to report on the Wapagasset groundwater study. I'm happy to tell you that we've got sample results in, and the mailings with those sample results will be going out this week, and those will be coming right from the Stevens Point lab. So that's really great that they're helping us with that. I worked with Kevin Mazarek, the groundwater education specialist, in drafting a cover letter for those results. And that cover letter will include information about the outreach event that we had talked about to help the participants interpret their results. And that event is going to take place 6:30 p.m. on September 8th. And I know that's a few weeks, months down the road, but remember, we have a second round of sample collection, and we only want to do one of these, so we're going to wait till those sample results are in, and we can cover everyone that participated in this study with that one virtual event. So with that second round in mind, we're doing another mailing for a call for samples, and that went out on Monday this week. So we'll be handing out bottles again on July 22nd, 23rd, and 26th. And those people that choose to participate will be able to bring their samples in for drop off on July 27th, and we'll get those to the lab on the 28th. Remember, I said we have sample results from our first submission to the lab. And if you'd like, I'd go through some of the summaries from those samples. I found it interesting. They have some questions on their information sheet about why you're testing and when your last test was, and some other information. And I learned that 73% of the people that participated had either never tested or not tested within 5 to 10 plus years. So we're catching quite a few people that have not had a recent test, which is good. As far as coliform bacteria, and again, coliform bacteria is an indicator of pathways to well contamination. So doesn't mean it's going to make people sick, but it means that there's either a pathway to contaminating that system, or it could have been a contaminated sample in the process of collecting the sample and so forth. But out of 52 samples, there were 7 positive for coliform bacteria. And that's 13%, which is less than the state average. Evidently, 15 to 20% of the samples that come into the water and environmental analysis lab are positive for bacteria. So we're below that. There were no positive E. coli samples, so that's good. E. coli is the bacteria that makes people sick. As far as nitrates go, pretty good shape so far. On average, the nitrate levels in milligrams per liter came in at 1.9 milligrams per liter. 18 samples or 35% had no nitrates detected. 18 samples or 35% had 2 milligrams per liter. And now once we get into above 2, that's an indication of land management or management on the land affecting groundwater. We had 8 samples. I'm sorry. Yes, 8 samples, 16% at 2.1 to 5 milligrams per liter. We had 5 samples or 10% at 5.1 to 10. And we only had 2 samples that were over 10 milligrams per liter, which remember is the public health threshold. And that was 4%. So I'm pleased to see those numbers so far, anyway. It seems like the samples below the public health standard are quite low so far. Now we're hoping to get another 40, 50 samples. I hope that trend holds up. Get those in.
Do you like where your samples are coming from? Like, are we getting a swath of where we might see nitrates, or are we just kind of, is it all in one little pump, or what, how is watershed sample?
We have fairly broad distribution, but at this point, I can't answer exactly where those sample submissions will plot out on the map. I know the addresses and the list that we sent to was a good broad distribution throughout that watershed. I'm hopeful that the samples that we get are a nice broad distribution throughout the watershed too, but that's information I don't have yet because we have not plotted exactly where all of the samples are.
I would want that. I would want to see that, because that would, to me, I just want to make sure we're understanding truly what for sure the nitrate piece is. We're only along the lake shore where we're not probably going to see high nitrate. Well, maybe we would. You know what I'm saying? Yep. We're up in other areas. Be nice. Look at it when you get it all knocked out.
Yep. We're hopeful we've got a good representation throughout. Any other questions? Much.
Great work.
Yeah,
It's
great
exciting.
info. Thank you.
Okay, moving on to the number 10 child support annual report, and we have a specialist here on that.
Good morning, everyone. I'd like these up sooner, so I don't want to. I know last month, there were a couple different annual reports provided, and I think I'm going to try and follow the same format where I'm not going to cover this in depth. I'm just going to give you an overview of what's in there. Not a real big presentation and
What we
report
needed,
kind of guy, so it's
basics will work.
pretty bare and basic, that's for sure. Thank you. Again,
Has
thanks.
this one already been reviewed by the administration Thursday at the general government and the executive committee? We went through all the annual reports, but I don't think we have this one.
No, unfortunately, I was on vacation last week. I didn't get back until Wednesday. And you bring up general government and the child support agency is in interesting situation because while like I kind of report to this committee, our budget actually falls under general government because we're under the umbrella of the corporation council. So the child support agency kind of reports to both committees. And so I'm sorry I missed Thursday's review of annual reports, which again, on that side would be kind of more on the financial side of things. For you guys, I try and talk a little bit more about and what we do child support providing to the public and families out there.
Being under, I know over the years, the all the reports like this was under corporation council. Has there been any changes as to the corporate council's responsibilities? Has it all stayed pretty much the same?
It has, historically, you're correct. Back when there was the Public Protection Committee, the Corporation Council used to report under there. And at that time, Jeff Hugie was the head corp counsel and the director of the child support agency. So he kind of just did the report all at once.
Yeah, instead of having a meeting like this, we used to once a month meeting in the Corporation Council's office, which Jeff was at the time. And so that's for the committee, that shows a change to where we're at now on this.
Correct. And, when the Human Services Committee, a couple of years ago, and perhaps it was before Mr. Hugie left, Ms. Malone was taking over. She thought that it'd be a good thing, not just to report to general government, but also report to this committee. And so, again, it's one of those things where we're kind of reporting to both committees. This time, there hasn't really been anything that's changed with Corp Council other than the fact that I've been made the director as of last year. And so Corp Council is our legal counsel now, where previously a member of the Corporation Council held the director position.
I think financially it's more beneficial on this format. Like, 2 years ago, we testified down in Madison, and unfortunately then, we were there for a 30% increase, and then the legislature cut it out altogether. And then they got so much heat that this year, I think they went to, what was it, 70% we were trying to get increased, Tanya,
For which one?
for the child support.
We were pushing for 4 million increase in GPR. We only got about 30% of it, if I remember correctly. Those numbers just came out. I've got a meeting with our state association actually Thursday. They're going to cover a little more what was actually.
That's where the big question is, where the legislature trying, they're hanging around 30%, and I think we were trying to address about 70%. I haven't seen the final figure. I imagine they stayed back around 30%.
It sounds about right. Yeah, they consider the governor considered we got about half of what we were asking for. In reality, it's more like 25 to 30%. So,
Yeah, in the governor's budget, he had about a 70% increase. But the legislature rejected just about everything.
well, the funding on the GPR side for child support has been pretty flat the last couple of years. There hasn't been an increase.
It's
So,
unfortunate.
right, we're happy with what we got, but we're obviously hoping for.
Yeah, thank you.
You're welcome. And so I'm just, like I said, I'm just going to kind of do a quick overview. It's a pretty basic report here. So the child support agency, we've got a total of 9 staff. They're not all full FTEs for purposes of child support. We've got 4 case specialists. This information is kind of included on page 2, the inside of your packet. So I'll kind of talk first about the full-time staff. We've got 4 case specialists, and they handle all aspects of child support, except for really kind of the financials. So they open the new cases, establish child support orders, and going to court, and working with the legal counsel. So, the assistant establish paternity on children who aren't established yet, and then they also enforce the orders of the court. So, court orders of this child support, job of the specialist is to enforce that court order to get collections in. The rest of our staff consists of, we've got a child support administrative financial specialist, and they enter the court orders into the system to help make sure that everything's being tracked appropriately for the money that's going to the families. We've got some support staff, which is primarily on the corporation counsel side, but a small portion of the wages are covered in the child support agency. And then as I mentioned earlier, we've got our legal staff, which is Joe and Malia. So Joe is our primary legal. His FTE count for us is about 60.60. And then Malia is the department head, and still helps cover legal duties for us. And so she's at 2. Looking back at last year, obviously a lot of the reports were talking about COVID and kind of what happened with that. And in our agency, it was the timing of it all was very interesting. Right before it hit, we were getting to a point where we'd be able to allow some of our staff to work. And obviously, when COVID hit, it had to happen right now. There are some challenges with that, with kind of how we deal with court documents and getting them filed and getting them reviewed by our attorneys and stuff before they're filed. But we found a good system that worked out well. We had one caseworker who stayed in the office the entire time. She didn't want to work remotely. We were glad to have somebody in the office because we were trying to reduce staff as much as we could in the buildings, as you're all aware. And then the other staff would work remotely, and as we were allowed to kind of start returning to work, they would come in and they'd work like half a day in the office. So they could process some of the paperwork, information to the attorneys, and then go home for the remainder of the day and work. It worked out well. It was definitely a change. Obviously, you're used to sitting at your desk and just grab and get what you need. But overall, it worked out well. So while there were challenges with COVID, some of the things that were positives that came out of our end, if you can call them positives, would be the stimulus money. So the first stimulus check that came out was could actually be intercepted for child support arrears. If someone was certified, they had arrears that put certain qualifications on an annual basis to have like tax refunds intercepted, the first stimulus check could be intercepted. And so as a result of that, there was good things and bad things that happened. The bad things that happened were if it was a family, let's say a new family. So a gentleman, for example, has been divorced. Now he has a new family. And under his new family, he gets a part of the stimulus payment. Your wife gets part of the stimulus payment, and then they have children. The problem was that entire amount of the stimulus check was intercepted by the state. And so there was a long backlog, not just on the state level, but on the federal level, to determine like just his portion of that stimulus check should have gone to child support, not current wife's or the children's portion. And so the state of Wisconsin worked well into December and January to try and get these things recalculated and out the way it should be. As a result, the money that we did give from students increased collections and our arrears because it was money that you expected. And so when we kind of get into what our performance numbers came out, and what those numbers were, again, part of that increase last year is due to the stimulus money. And the other reason for that is, as a positive, is because there were so many people that were kind of they had to stop working. Again, we all know COVID is. So it was difficult for us in some aspects of our job to try and enforce a child support order. And the person is told that they can't go to work because COVID, like business closed or whatever. So it was an interesting year and challenging year, kind of on both aspects, to try and enforce an order that at the time we can't enforce. So that's it's kind of a overview.
Kind of what you say is you were between a rock and a hard place.
Absolutely. Well, and the other thing too with kind of the courts having our courts never shut down, but they stopped in-person hearings and we had to move to Zoom meetings and stuff. And so in order to establish new orders, usually in the past, we had met with parties to gather information, to do the calculation on those orders and then present it to the court. And so it was all new process for us. And so when you look at our performance numbers, which is on page 3, that's one area that I feel like perhaps didn't increase as well as it had been in the past would be our establishment of court orders. And that was just kind of because our hands were a little tied with being able to get into court and establish those orders.
All in all, did it help your arrears
It did. And
percentage?
it did. And so if you guys want to take a peek on page 3, kind of in the upper third section there. So the Child Support Agency has 4 performance areas that we're kind of judged on, the state and the feds. And so that's court order establishment, our current support collection rate, so for a current child support order, our paternity establishment rate, and our arrears collection. And so for 2020, we had a court order establishment rate of 81%. The state average was 86%. The goal is 80%, so we met that goal. We were above that. Current support collection rate of 78.72. The state average is 74. Paternity establishment over 100%. State average is 100%, and our arrears collection rate was 77.45, and the state average is 73. Our current support collection rate last year was the second highest since 2013. Again, one, we had the challenges of not being able to enforce orders because people weren't working, but then we also had the stimulus money. So I believe kind of as a result of that, we were able to increase that current support collection rate, the second highest since 2013. And
Tanya, wasn't it a year or 2, or was it longer than that, where we got this award for the highest collection in the state? Were you on then, or was that in the last year that Gretchen was here?
I think that was through economic support, so more benefits awarded and timely processing and that kind
Your second highest in the state is really awesome.
Can I just ask a quick question?
Yes.
Are you able to get some money from their unemployment?
we are able to collect from unemployment. And so that was another area because people were getting additional federal funds from unemployment. And so there was a time period there where there was a challenge as to whether or not unemployment needed to withhold from that higher amount that was coming in from the federal funds, or if it was appropriate to withhold just from their regular unemployment. But yes, we are able to withhold unemployment.
That was a great question, Rita.
Yeah.
What did you end up deciding, the whole thing?
Well,
or just,
it wasn't our local agency's decision. It was based on the state, but the decision passed down from the federal government on as far as that additional withholding was that we could not withhold.
any,
Not from the additional federal withholding. So I think it was what, an extra $600
there.
that people were getting. Yeah. So if they were on unemployment, state level, we could withhold from that. So 600. Yep. And just kind of how that translates into numbers. Polk County, the Child Support Agency collected a total of $3,400,000. I've got a typo there. I apologize. $3,400,000 in current child support that went out to not just families in Polk County, but for all the cases that we cover, because we do have some cases that we process and enforce for people who live in other states. So under our caseload, which is about 1,700 cases, the total current support last year was 3,400,000. I again apologize for the time. As a result of that performance for last year, I believe it was announced at the county board, but we did actually receive an award for last year. It was the Outstanding Achievement Award presented by the Bureau of Child Support. And I did include that letter in the award in our annual report here. And that was for our performance on 3 of those measures. The fact that we had an increase in 2 of them, and we had our paternity establishment rate greater than 90%. So
Is that a letter of outstanding achievement? Is that just in the letter form, or is that something that's going to be coming up in a presentation situation?
it was just in letter form. The presentation actually happens at what would normally be the Bureau of Child Support. We call it our Director's Dialogue. It was virtual this year. That usually happens in April or
You
May.
need a big congratulations on
Yeah,
Thank you.
Thank you.
It was definitely the staff that deserved that. 'Cause again, with all the challenges that they faced with going from their regular routines to now having to work remotely and figure out new ways to do their job.
You have that in the minutes of the announcement. It's surprising now with everything, the number of people that read our minutes of all the departments. Have a lot of calls and appreciation of what's in the minutes.
And I don't want to take much more of your time. I guess one more quick thing. So another great thing for our agency last year was for 2020, we were fully staffed for the first time in about 3 years. We had some retirements, some advancements, and so we for 18 and 19, we went through a time period of not being fully staffed. And so 2020 was great that we finally had full staff, and just some numbers on that. With the staff that's in our office currently, there's 70 years and 7 months of child support experience here at Polk County. And then one of our workers, she started here 2 years ago, but she came from Minnesota. She had 22 years of child support experience. And so that brings our total child support experience to 94 plus years. So that was kind of a fun thing.
That's one of the most outstanding figures of our years of experience in these 4 child support people.
And so that was fun. We just had to collect that data. The state of Wisconsin, we're going to try and do a report on total years of service, and that'd be a fun little fact to share with you.
Chad, you're not that old.
Actually, I've got like the second most number of years.
How many years do you have with the agency?
Over 22. This is my.
For you, congratulations.
Well, I could tell you what the old experience.
I just remember Chad when he was in high school, so he can't be that old.
That's a good point, Bill. I just personally want to give you a big appreciation of your department. Unfortunately, with the COVID and that, we haven't had the opportunity for you people to listen to these 4 people that we have as child support people that go out there every day. Once a year, I try and have our meeting at the Golden Age Manor in Amory. And between now and the end of the year, maybe September, October, we can achieve that. I remember one time we came to a meeting here that when we used to have it over there, and there was 272 little butterflies or something. And we came in, what's all this about? And those 4 child support people were there. And they said, this is a number of cases that each one of us has. Then 2 years ago, we had these 4 child, 2 of the 4 at Amory at our meeting. And they told about their, one day, they just picked a day out of their work log. And they were called in to school. Kids hadn't been to school out there, and they were all quarantined. They had lice infected. So they had to take and buy them all new clothes. They had to isolate them from the family. Fortunately, we had a room in the old jail here, and they had to feed them, and they had to separate them from the family. They find a home for them that day, and they had a scheduled appointment with the drug deal with the sheriff department at 6 o'clock. Took in 5 more kids. Fortunately, they got them placed that night before midnight with some family. And to listen to these 4 people, now you said you're full staff, but you're full staffed according to what your budget and everything
Yes, ma'am.
allows. But the court system recommended, they looked over this child support people on the state of Wisconsin, and they recommended that in just about every county, that child support staff need to be doubled. We're one of the few that doesn't have almost a yearly turnover.
Yeah, for 18 and 19, it had been several years. You're right, we just didn't have any turnover. So it was a bit of a challenge in 18 and 19 to be understaffed and then to just not have that familiar routine that we had.
You just can't realize how these child support people go out to these homes. But I think that most of the time, they should have some sheriff's support people with them or something. And that particular meeting, them 2 ladies had to leave the meeting fall, and we weren't far behind. That's the only reason that I can say that I stay with the Health and Human Services, is to get some of these things done. You just gotta keep on trying to get more people, staff up to date, and service the people that are, it's the kids that are out there that are really need to. Thank you so much.
You're welcome.
Thanks, Chad.
Thank you.
Thank you.
Number 11, public transportation support, and I'll give a little report on that. At our,
Chair Bonner, we go back to the child support.
we aren't finished on that?
Well, I just want to clarify, so there's no confusion, the
Yeah, I
stories that
apologize. Why
Aaron,
don't you finish everything up?
yeah, the stories that you were recalling from our board meetings are the children and families unit. So those are the child welfare workers. Chad's unit also touches most of those families, so they're just as busy. But I just wanted to make sure that they don't do home visits. I don't think you guys do home visits, right? So they're in the office processing all of probably the work that we're sending their way. Those child welfare workers are the ones who.
Yeah, they're the
Those
ones
kids,
that I
yeah,
referred to.
yeah,
I
Yeah,
probably don't have them
yeah.
in the
Well,
right
yeah,
department.
Yeah, so if there's questions, we can
Sure.
answer those. I just want to make sure. Yeah. That's all I had.
So, last Thursday at our executive meeting, we went and the general government, which was right after executive committee, and you're probably taken up by both, was this huge transportation that, and Bill, you had a big interest in that. We just lack really public transportation in Polk County. Older people, the veterans do a pretty good job of taking care of our veterans, getting transportation. But we have, like, in St. Croix County now, they have a bus, I think it's several, and every so many scheduled hours. Buses leave from Eau Claire and they have stops in Hudson and so forth. They take people to the airport, to jobs and so forth. And that's one of our big concerns and needs in Polk County. Just want to make you know that we had a lot of discussion and Superintendent, Supervisor Pritchard is, it's his big concern of being on the board is our public transportation.
Add to that.
Sure.
So what we will be doing, partnering with EDRC, we'll put in our budget and work with all of the different grant funding sources that we have combined to be able to do a transportation needs study sometime in 2022. So that will come through on our budget. We'll work with regional planning, and then I've also asked Tim Anderson, our local planner, to be at the table. So,
Yeah, Tim could be a specialist, or is a specialist.
yeah, last time when we were contemplating a need study back in 2014-15, we would be working with regional planning and they would be enlisting students from UW River Falls to actually do the survey. So it's a pretty big deal.
The comments on transportation was pretty much through the ARC, which had made a lot of progress on that, and on the economic development side. And Vince, that's how we got to Polk County, I think, is on former economic development. It's always one of the big things on the headlines, isn't it?
Yeah, I think it's that the economic development is the area where we could look for opportunities and not just big picture, but for the little picture, the people who have to go to work, maybe can't afford to have 2 cars or 1 car. We'll also look at how it might attract people to the area, either coming here to work or coming here to.
I think the comment was made from the economic development director is companies that are looking for people to work. It's a transportation issue. There's some people there, but don't have the transportation. And I know Dr. Lagas, he feels the same way about people that need transportation getting to the clinic and things like that. It's one of our huge issues in the county. Don't
So
know.
are you saying that your needs study and then your economic development component, are all those going to be merged together? Is that what you're saying?
I think we're saying we're going to look at all those things. I mean,
Yeah.
the biggest issue is to say, if there's a need, what specifically is that need and how can we address it?
Yeah.
I mean, we're not going to have a train running from Balsam Lake to Twin Cities, right? More than likely. So just what is the need and what are the types of needs out there? That's what we need to find out.
It would be nice if we had a tree. They used to have a tree.
Vince, really, that's not funny that economic development guy, what did he say about a train from Eau Claire?
The trail.
Well, I think, I don't know about Eau Claire, but I know from Hudson, I think that they're looking at a corridor or something, but
Yeah, the economic development guy mentioned something about there's research and about a train. And that, I
Yeah.
thought, that really
big
hit me.
picture, and my thought is it probably would go along that corridor first, and then our challenge would be, okay, is this something we have to align transportation down to Hudson or New Richmond or
Somewhere.
Like in Minnesota, they have these, like, they got colors, green line or,
They're all losing
and
money.
they have these
Yeah,
train lines,
Money, yeah.
they have these train lines that go like to Mankato and different places, and I don't know a lot about southern Wisconsin, but I don't know if that is that developed at all.
Yeah, I think, just my opinion, based on what I've seen, is we're gonna look at a smaller scale than that. I don't know that we have the population to afford a train system. But, so if we can find out what the most pressing need is, maybe there's something we can do in conjunction with ADRC and the vets and maybe some other organizations to say, can we provide public transportation for these folks? So the main thing is we got to find out what exactly is needed. So that's what we're going to do first.
There must be more in southern Wisconsin too, because this is a little bit off subject, but I have a cousin that lives in East St. Paul, and he takes one of these to, he's got two daughters in Janesville, Wisconsin.
It's Amtrak.
Yeah, and Troy, he said it cost him like $5 to go back and forth, and it don't take long. So, yeah, transportation is a big thing. That's a little other information. State and local budget updates. I guess now maybe I can make a presentation on that. So I'm the representative of the county, what we call a steering committee to the Wisconsin Counties Association, which all 72 counties meet. Since I've been on this, we've met just on the Zoom, but now starting next week, we'll be having all the meetings in Stevens Point. I'm on 5 steering committees, and so the first one is next Thursday or Friday. This coming Friday, and Polk County has a resolution on this committee, and what it is I'll just kind of read Wisconsin Counties Association 2021 Conference Resolution. The resolution is introduced by Polk County for a base funding goal for county conservation staffing with all the things on the horizon, the COVID and everything, and water quality, everything being urgency. Polk County and the staff has put this together, and I'll just read the last. There's that 1, 2, 3, 4, 5, 7 whereas. This all goes, but the last one says whereas an increase of base state funding for county conservation staffing will result in more conservation on the landscape and the better protection of water quality. And this has been passed by the resolution committee, several committees on each resolution. And so I think it has a pretty good way of getting what will happen. We'll vote on this, and then the county, our county's legislative person, I think it's Dan Barr, he'll make a presentation to the legislature, and I'll make a presentation Friday. And that's why Thursday I'm gonna try and meet with Bob Kaspersky and get me up to date a little bit of how the staff put this together, and I'll certainly have some questions. I'm gonna leave this this whole agenda. I've got another one that's sent with me, and I'm gonna leave this whole agenda on Friday at the clerk's office if anybody wants to stop and look at it. I don't know how many resolutions there is. There's the one from Bayfield County, which you've been pretty interested in, on the sighting of animal. There's a resolution. Yeah, there's a resolution on that, Bayfield County, supporting a change in state regulations and legislation to require meaningful local input in the siting of concentrated animal feeding operations. Okay, folks. So we really address pretty much all the important things that concerning health and
for next week's ES meeting on Wednesday, they're gonna be speaking to that first resolution that you were speaking of, and it speaks directly to who they're kind of looking to have. If you want, that agenda packet will be going out on Wednesday to the supervisors. So
Yeah.
if you're wondering exactly who they're looking to bring on.
And I'll try and bring back as much information. And once again, I will leave this with our stuff. That's an update on help our budget and things like that. 13 subject matters for August 10th meeting.
Go back to number 12. So just briefly, you know, the governor did sign the budget. And distress, I think, he's not happy with it. Key things were omitted. One that will affect us is Medicaid expansion. So, you know, there's still that lobbying back and forth, and we don't find out what our grants are until usually November after our budget's passed here. We make our adjustments accordingly. Locally, we are in the throes of putting together our 2022 budgets, and I see that next month we have public hearing at 9:30. We're required to do that for the state, at least for the
That's on our August
services
10th.
for the August meeting.
That'd be 9:30 in a public hearing.
Yep, and then
Bring that up.
we'll be presenting the 2022 budget. That's on the agenda.
And then our committee will
Guys.
vote on that at our regular meeting. After your
Yep, after we
hearing,
close the public
we
hearing.
vote on that the same day.
Yeah, and then I think in September, we bring back for amendments, and then
Yeah.
working through the process with administration. But you should have our 2022 budgets by next month, along with our fee schedules. So we are all busy meeting with the individual departments and then putting that together.
Tanya and I talked on the phone about some of our legislative things. Thanks for bringing that up. Anything else or any questions on our
So next month,
budget review?
yep, well, next month's meeting is August 18th at 9:30.
It starts at 9:30. We hold that public hearing. We advertise it in the paper.
And
August
August
10th.
10th.
It's August
August 10th.
August 10th.
August 10th.
Second
That's what I
Tuesday.
got.
Oh, because I'm looking on the work plan, it says August 18th.
Is the meeting.
Okay, it just screwed me up because I had my calendar.
So I've been in touch on the phone this week with Jay Magnifici and State Senator Rob Stafford. And one thing I requested of them was to try and get our legislative meeting started again in Richmond on a quarterly basis. That's always been, to me, real helpful as far as bringing things to our legislators. I went over with Gaia quite a bit on the things that were passed and not. This doesn't have a lot to do with our committee. It probably does with water situation. But the big thing that the governor did approve was he did approve the funding for the Clam Falls. He vetoed just about everything else that the legislature came up with. What she was concerned about was there's a extension of $300 a month for additional unemployment. And the legislator felt strongly, hey, we got too many people now that are getting paid and everybody's crying for work, but it's a platform issue, party lines. And what she was happy about was $2 million. The county would still own the dam, but if we do finish that, and you'll have to talk to all the rest of the supervisors about that. But there would be, from what I understand, there'd be $2 million that the DNR would have for repairing the dam.
There are other criteria or other hurdles that have to be.
Yeah, do you want to speak on that, Vince?
Well, if you recall that what the resolution stated when we passed it was if we got the state budget to pay for it, and the early estimate was up to $2 million. Then we'd also look to see if Clam Falls would have significant skin in the game, so to speak, paying for insurance and normal maintenance. And also, we wanted an escrow fund established to basically cover us if for some reason there needs to be a repair once we take
Maintenance.
ownership, or if we have to tear it down at some point. So right now, we're in the process of investigating the estimates that we've got from Northwest Electric and Regional or World Energies, because we don't, we want to make sure that if we got $2 million to repair it, we want to make sure that it doesn't cost $2.5 million. So
Did
we're
Brad
looking at those
Olson
types
say
of things.
something about the Clam Falls Town Board helping with insurance or something?
Well, the town board is looking at how much they can afford to contribute, and we threw out initially that the liability insurance alone would be about, starting now, would be about $16,800 a year or something like that. That will increase. And so the thought being is maybe they could contribute up to $20,000 a year
12 people who
in some fashion. But again, no matter what gets decided upon, no matter what Northwest Electric and those folks say, here's how much we're going to put in that escrow fund, it's still up to the board to decide if we want to go through with this and own.
I think it's been pretty unanimous on the board in support of it all.
I guess this isn't even on the agenda.
No,
It doesn't
it
have
isn't.
anything at all to do with health.
No, we're
I
just,
feel like we're kind of wandering.
Yeah,
here.
we are.
You know, some of us have time. So,
I need to apologize for that, but I said I want to make a comment. Tanya, anything else, any supervisors or committee people?
Have something for next month's meeting. Late last week, I think, the Supreme Court ruled a couple interesting cases around high-capacity wells in maybe CAFOs or not, I think just generally. And the other is when you're citing a CAFO, you can consider, they ruled that you can consider surrounding public health pieces. So I don't know who this person is, but I want to have some sort of virtual presentation, and I would love it to be a public health perspective. So I can work on that, and I don't know if I want to, do I work with Tanya or Jean on who this person would be? I just work with you on that?
Yeah, you will.
Okay. I just have to make some phone calls. I just have the newspaper article, and I think it is important for us to be abreast of what's going on at the state level. So I'll just work on that and get back to you.
And if you get any information as far as that on the agenda, give me a call.
Okay.
Bill?
Just real quick, Tanya, just to follow up on your annual report, I thought the overall thing was excellent. I just went through it. Just a couple of clarifications. Of course, I've got that school mentality. There were some statistics in here on high school students getting 60 minutes of Phi-Ed 5 or more days a week. And there were percentages in there I'm on page 7. I'm sorry, page 7. The question that I had is just for clarification, because sometimes statistics are a little strange. I know that PE is required at all public schools. So when you say like in 2019, there were 62% of kids getting Phi-Ed or physical activity. Is that because of PE requirement, or does that include athletics?
That I will have to pull back, and Jean and I will.
Yeah, I'm just thinking that just for clarification in there, I know what it is. Basically, it's based on PE because it's required. But just for clarification. The other thing I think that needs to be clarified in there too is students eligible for free and reduced price lunches. I'm not sure you had, in 2018, the stats that are in there, you had the number 37 And then in Wisconsin, the average or whatever it is, 37, and then in the US, 49. I'm not sure what that means. Is that 40% or whatever? I went through and looked at all the school websites and looked at, and they're broken down into elementary, middle school, high school statistics. So I know how many kids are getting free and reduced lunches by district, but when those statistics come out, I'm not sure what those mean. The other thing, there's just a couple of other comments. You guys are doing a great job on jail health. I have to give you compliments there, and the staffing over there. It's going extremely well, and the reporting is great. Oral health services. Only 5 of the 8 school districts are on the fluoride program. I was just curious. Luck, Unity, St. Croix Falls, Clayton, and Frederick. Means that there are 3 that are not. I was just curious why they're not.
Maybe they have fluoride in their municipal water supply?
I remember when Gretchen was here, we talked about that, and I think there were a couple of those municipalities, I'm not going to mention any, that voted not to have it in their municipal water
Hospital, I
supply.
think Red Falls are 2 of them.
Well, I know Amory does.
Right, and so that's why I'm just wondering if that's the case. Yep. Other than that, I didn't have any other questions, just some little things. Overall, you guys did an outstanding job with this, so thank you for doing
Bill,
that.
as an administrator, is there, you mentioned this FIAD recreation
Yep.
and all that now. Is there, parents can request that their kids not be in FIAD?
Only if you have a physician's note indicating that because of some type of a physical abnormality, you can't participate.
Are you guys okay with us just putting this out in an email?
Oh, yeah, that would be great. Yeah, that's fine. Yeah, absolutely. Oh, one other thing, just a little thing here. You had, on page 37, you had interns that were listed for, you're hosting interns. You had 2 for the health department, 3 for behavioral health, and 2 for business and operations. Are those from universities, specific universities that you're getting interns from?
We work with several universities along with the technical colleges.
Okay, just to give them credit, I was hoping that you might list them. Whether it's Stout or River Falls or, I think it's kind of cool to have that in your annual report.
And I don't believe we did any of the state colleges. These were more private schools and WIGC.
But just to give them credit, I think that would be kind of cool. Okay, thanks.
Well, thanks, Bill. Anything else for the agenda before we adjourn? Any supervisors' questions? Okay, motion's in order.
Make a motion to adjourn.
And no discussion, all in favor? Aye.
Guy?
Adjourn carried unanimous. And I'll submit this back to the clerk and
Health and Human Services.
some interesting resolutions in here.
See that.
Where did that come from?
This annual report.
Community services.
It's in my.
So I'll be down on Sunday to announce your baseball games.
I'll be there on Sunday.
Perfect. I'll make sure I find you.
No, the supervisors, but yeah.
Yeah.
I looked for you last Friday.
Could I?
They got a heck of a crowd.